Here's what you need to know about the Direct 1525 plan option. The Direct 1525 plan option has in and out of network benefits. There's an unlimited benefit for you and your dependents both in and out of network. There are no limitations on pre-existing conditions. Any provider who participates in the Horizon Blue Cross Blue Shield Direct Access Network is considered in-network. If a provider does not accept and participate with Horizon Blue Cross Blue Shield, you will be subject to the out-of-network benefits of the plan. If you're traveling out of state, any doctor who participates with Blue Cross Blue Shield will be considered in-network. If you are within the Horizon Blue Cross Blue Shield network, the following are highlights of the benefits. The Direct 1525 plan offers free preventive care. Preventive care includes your annual checkup, GYN exams, PAP, mammograms, prostate cancer screening, colorectal screening, immunizations. There is no deductible in-network. There is a $15 copay to see your primary doctor. A primary doctor includes general or family practitioner, internist, or a pediatrician. This only applies to sick visits. Remember, all wellness is covered at 100%, no copay. There is a $25 copay for a specialist doctor visit, which includes maternity visits, physical therapy, speech therapy, chiropractic, diabetic education, mental health office setting visits. As long as a doctor participates with Horizon Blue Cross and Blue Shield, you do not need a referral to see a specialist. If you or a dependent go to an emergency room, you will be subject to a $75 copay. It is important to know that all emergency rooms visits are considered in-network, regardless of whether a hospital participates with Horizon Blue Cross Blue Shield or not. If you or a dependent get admitted into a hospital, all the associated costs are covered at 100%. Some of those included are admission, including maternity, room and board, pre-admission testing, surgery in hospital, inpatient physician services, outpatient department services. If you or a dependent have outpatient surgery, the surgery and the surgery center are covered at 100%. Laboratory is covered at 100%. There is no copay. This applies to lab work done in the office or at any LabCorp facility. X-ray and radiology services are covered at 100%. There is no copay. Infertility is covered at 100% after a $25 copay. This includes in vitro fertilization. There is a limit of 4 egg retrievals per lifetime. The following are some other services which are covered at 100%, no copay. Acupuncture, bariatric surgery, home health care, hospice care, skilled nursing facility up to 120 days per year. A routine eye exam is covered subject to a $25 copay. Frames and lenses are not covered under the medical insurance. The in-network annual maximum out-of-pocket cost is $400 for an employee-only election. The in-network annual maximum out-of-pocket cost is $800 if you have a spouse and/or dependents on the plan. The out-of-pocket maximum runs on a calendar year basis, January to December. If you choose to receive care from a non-network provider, you are welcome to do so. A non-network or out-of-network provider is a doctor or a facility who does not participate with Horizon Blue Cross Blue Shield. All non-network care is subject to a deductible and coinsurance. You may also be responsible for costs above the 90th percentile UCR table of costs. The 90th percentile UCR table sets the average costs of services in a geographic area. If your doctor bills you at a rate that far exceeds the majority of doctors in that area, you will be responsible for the difference, and the difference is not included in your maximum out-of-pocket. The deductible is the amount you are responsible for before the medical insurance plan starts paying. The deductible for an employee-only election is $100 per calendar year. The deductible for all other elections is $250 per calendar year. The coinsurance is the percentage of the bill which will be paid after the deductible is met. Once you've met your deductible, the medical insurance plan will pay 70% of the bill and you will pay 30%. You will pay 30% of the billable charges until you reach your out-of-pocket maximum. The maximum out-of-pocket for an employee-only election is $2,000 per calendar year. The maximum out-of-pocket for all other elections is $5,000 per calendar year. I'm giving you the highlights of the plan, but please refer to the detailed benefit summary for a complete list of covered services and costs. Some services and procedures will require pre-authorization. If you have any questions about this or need to reach Horizon for any other matters, you can call them directly and confidentially at 800-355-BLUE or online at www.horizonblue.com. Please also note that the individual mandate of the Patient Protection and Affordable Care Act requires all U.S. tax filing residents to maintain appropriate medical insurance either through an employer, a spouse's employer, Medicare, Medicaid, VA, individually, etc. Starting on January 1st, 2014, failure to show adequate health insurance on your taxes will result in a penalty by the IRS of 1% of your income or $95, whichever is greater. The penalty is set to increase to 2% of your income in 2015 and 2.5% of income in 2016.